Hey everybody, this is Dr. Vince, physical therapist in Joliet. Today we're going to discuss total knee replacements. Total knee replacements are extremely common to see in physical therapy. Almost all of my patients over the age of 70 either have had one or are considering one. Some of the information that you'll need to know specifically after a total knee replacement is that up to 37% of patients 1 year after a total knee replacement continue to have functional limitations. And that can be as simple as difficulty with going up and down stairs, walking speed, balance, or returning to their recreational activities. One of the topics that they think may cause this is an impairment in what's called mechanoreceptors, which are sensors within the joints that tell your body where it's at in space. For instance, I can close my eyes, find my nose, find my ear, find my mouth, because my body has been there many times over my lifetime. Obviously, it's been to my mouth if you take a look. But my joints know exactly where these different positions are at in space. Now, if there's an impairment to the mechanoreceptor, we may see an impairment in going back to finding where I'm at in space and understanding where my joints are going. Now, if that happens to the knee, we may see that with balance limitations. And so if those mechanoreceptors are altered, we may see impaired balance after a total knee replacement. And so there was actually a research study that looked at traditional physical therapy and compared that to traditional physical therapy plus balance exercises. Traditional physical therapy is a lot of range of motion and a lot of strengthening exercises, but it doesn't necessarily have to include balance exercises. Some of the articles that are out there talk to squats, range of motion, hip abduction, kicking the leg out to the side, bending the knee in standing, going up onto your toes. So it's a lot of strengthening exercises and functional strength, lunging up and down from a chair, but they don't necessarily incorporate balance exercises. And so there was a research study that looked at that, and what they found was by incorporating balance exercises, they see a 25% improvement in walking speed compared to those who were just performing strength and range of motion exercises. Now, this is also interesting because we continue to see those improvements in walking speed up to 6 months after the total knee replacement. That's not typical. Typical, what was expected was that we would almost plateau at 3 months after the total knee replacement, but when you include balance into the interventions or into the treatment, we continue to see progress over the course of time. So that's extremely important. The other thing that we saw was that single leg stance was improved in those patients that did balance exercises. Obviously, that's expected based off of the SAID principle, specific adaptation on imposed demands, which essentially means the more you practice it, the better it becomes. And so this is also important because in those who didn't work on balance, their balance either maintained or worsened over the course of the study. And so just by performing strengthening exercises and range of motion exercises, it doesn't necessarily lead to an improvement in balance, which goes against some of the traditional thought in therapy is that balance issues are purely a relationship with strength, and we know that's not true, but for some reason that idea continues to propagate in practice. So to conclude, there's some tests that should be done when you go to physical therapy after a total knee replacement. One big one is single leg stance. Okay, we want to see how well your body can maintain itself on one limb. And that gives us an idea into a few things. It tells us, the integrity of it's called motor control, but other people may refer to it as core strength. Okay, how well do your hip muscles interact with your trunk muscles in order for you to maintain your balance so you're not weaving back and forth? And if you are weaving, can you correct? Okay, there's one study out there that looks at core stabilization, and if you can't stand for 80% as long as you can on your other leg, that's considered a deficit. Or if you can't stand for 50% with your eyes closed compared to the same leg, that's considered a deficit. So single leg stance is one of the tests that should be done when you go into physical therapy. Another test is called the chair rise test. It's very simple. You sit down and you stand up. But in all seriousness though, the test is done either over the course of 5 reps or over the course of 30 seconds. I personally prefer the 30-second chair rise test, and you can go to the CDC, or if you just Google 30-second chair rise test, it'll give you the norms for your age and for your gender. Another test that we would look at is gait speed. How fast do you walk, either over the course of 10 feet down and back and have a seat, over the course of 10 meters, over the course of 6 minutes, 3 minutes. We're really looking to see, one, are you safe for community ambulation, and what does your overall health look like? There's a good study out there that I highly recommend everybody take a look at it. If not, at least read some of the blurbs about it. If you Google how fast does the Grim Reaper walk, I'll do a review on that at a later date. I haven't done one on that yet, surprisingly. I've got over 100 articles that I've reviewed, and I haven't done one on that. The last thing that we should be looking at is some way of measuring balance. And there's a few tests that are used commonly. One is, after you have your knee replacement, you typically end up either in a home health situation or a skilled nursing facility. And in those areas, you'll see the Tinetti, which is a very low-level balance test, is used because we're really looking at safety. But once you get out of that environment and you get into an outpatient facility, the Tinetti shouldn't be used anymore, because your ability to score perfect on that test becomes pretty simple. And so we need to use a higher level test, such as the Berg Balance Scale or the Dynamic Gait Index, where we're really looking at you moving, either with you moving your head or stepping over things, or standing on narrow bases of support, like standing on one leg, because we want to assess your balance and your fall risk. So again, to conclude, 37% of patients typically have limitations following 1 year of knee replacement. If you do balance exercises within your physical therapy sessions, and you continue to do your balance exercises at home as part of your home exercise program, you see improvements over those that don't do balance exercises. Balance exercises are vital to continue to see improvements. If you have any questions, comment below, and thanks for watching.